finally, let's welcome Dr. Max Benenati of Novant Health Surgical Associates. Dr. Benenati, thank you for coming in today.
Thank you for having me.
I know how busy you are, so I really appreciate your time, and it's always really good to have you. So quickly remind our viewers a little bit about your background and your education.
Right, so went to medical school in Lake Erie College of Osteopathic Medicine, residency over in New Jersey, across the bridge from Philadelphia at UMD&J. Traveled to Maryland for fellowship, where I did a minimally invasive fellowship there with a focus on foregut and hernia. And now I've been here for coming up on 6 years.
Wow, seems like yesterday.
Yeah.
I remember the day you started.
That's right.
So tell us a little bit about your practice. It's Novant Health Surgical Associates.
Right.
Tell me a little bit about that.
Right, so there are the 5 surgeons, 1 PA, so 6 providers. We're constantly growing, adding on services. It's really been amazing to see the growth and change, even within the short period of time that I've been there. We've got great staff taking care of the patients and us. We have the different offices, Carolina Shores, the Bolivia. I also go up to Leland. So we're really reaching out to the community and offering a lot of varieties from breast surgery to abdominal to just really the gamut of general surgery.
General surgery, yeah. So what are some of the most common surgeries that you do?
So oftentimes a surgical week might look like several gallbladders, hernias. This week I've had 3 hiatal hernias, which are a lot of what my fellowship was focusing in on, which is for reflux. It's not uncommon we get the appendix or the bowel perforation, so colon surgeries, things like that, the breast biopsies in the office, and today I saw a thyroid post-op patient, so pretty common to do a lot of the general surgery options.
Yeah. Well, I understand there's a new baby in town. We have a brand new DaVinci robot at Novant Health Brunswick Medical Center, correct?
We do indeed.
It was a great day, huh?
Yes.
Tell me about the benefits of this new DaVinci robot.
So we recently upgraded to the XI, received that and just started working on it within the past 2 weeks. It is a newer platform than the SI that we recently had. The energy device is more advanced. The optics are better. The 3D vision that we get when we sit in the console is just amazing with the camera. The microscopic movements that we can do that remove the tremor. It's just, the technology is really from the future, basically. It's just amazing.
I can tell you're really excited about it.
Yes.
It's like a new toy.
Yeah. We consider it, so the big thing with the robot, people wonder, is a robot working on me? And it's the big thing with the robot is it's more than just a toy. It's the instrument that I'm using to do the same surgery. So in my arsenal, it's just another instrument that I can pull out and use on a patient if it's appropriate. So it's been wonderful.
And the surgeon is calling all the shots.
Yep, every single step.
That's right. So what type of procedures would you use this particular DaVinci robot for?
So it's a very capable platform, the way that we're able to bring it in over the patient. OB is able to use it, urology is able to use it. I do abdominal surgeries, hernias, gallbladders. My hiatal hernias it's been very useful for. So let me think. Those are my colon surgeries. Regardless of where I am in the abdomen, I can really angle it, reach anywhere that I need to be.
Tell me what your speech sounds like when you're talking to a patient and you're recommending a DaVinci robot procedure.
Right. So in general, that's my, since I'm fellowship trained for the MIS, I generally offer people MIS surgeries when it's appropriate, and for the most part, that's the way people want to go with the small incisions. They want to come to me and have big surgeries done with small incisions, and oftentimes go home the same day. So what I'll do is say the way that I would recommend this happen is that we do the surgery with the tiny incisions, and oftentimes the tool I will use on this is the robot, and it's this machine that we're able to place over you. We connect, and then I sit about 6 feet away where I'm able to do the operation. Monitor you, the anesthesiologist is monitoring, the whole team is still around you.
There's a whole team around that table with the patient.
So we're still intimately involved in the care. It's not a microwave, set it, forget it thing.
So there's many benefits to it, but one of them is a shorter recovery period,
Right.
correct?
Yep. So
And I would think patients would really like that. Are there any instances where you don't believe surgery using DaVinci is the right way to go?
So anytime that laparoscopic or minimally invasive surgery is not indicated, same thing with the robot. It's just a matter of is it the right patient, the right tool for the right patient. Certain situations, it's just not feasible to do the little incisions, and you need a larger incision. Sometimes bowel perforations, if there's just a lot of contamination, it's not the right tool. So there are plenty of situations where I do not recommend it, just because in my experience and professional opinion, we need to do it a different way, and the patients often understand that.
Well, that makes sense. And on a side note, before we close, are you accepting new patients?
Absolutely, yes. Yep.
And they can just call the office?
They can call the office. They can go through their primary doctor. There's several of us in the office that are happy to see people.
Great.
If they ask for Benenati, I'm the Italian, but we have a couple of Italians. So.
Okay. All right. Well, thanks, Dr. Benenati. I appreciate your coming.
Thank you. I appreciate being here.